Anathea Health Cancer Institute at St. Joe Hospital is on a mission to educate the community on why it's important to get a colonoscopy. I had the chance to talk with Dr. Powell about why this is very important, especially in the minority community. We are here at Dignity Health Cancer Institute in downtown Phoenix with Dr. Powell.
Yeah.
And Dr. Powell, we're talking colonoscopy.
Yes.
And I get to brag.
Yes.
I can brag, right?
Absolutely.
I got one done. And I am healthy, don't have to have another one for 10 years.
10 years.
So, but we're here to talk about it because we're seeing a rise in colorectal cancer in the African American and Latino communities, and at a younger age too. And that's something that we're trying to prevent.
Yes, we're seeing an increase in colorectal cancer in all people under age 50, but the rate is nearly twice for African American people than white, and also increasing in the Latino community. So we really want to get the message out there that get screened, because the age has been lowered to 45. So if you're over 45, you should get screened.
So let's talk the difference between a colonoscopy and the Cologuard.
Cologuard, yep.
Yes.
Yeah. So Cologuard is a stool test. It's done every 3 years. Sometimes it's covered by insurance, sometimes not. It's a good screening test, but it's not quite as good as colonoscopy because it can't remove things. It can detect a problem, but it doesn't remove the polyps like colonoscopy. So we think colonoscopy is the best thing because it can remove your polyps and actually prevent colon cancer, where the stool test can only tell you if you have a problem. So you kind of get everything done in one shot with a colonoscopy.
And that's why it's important to come down to the Dignity Health Cancer Institute to talk with you about it, because at first, I'll be honest, I was a little nervous, a little scared, because you hear all these myths about it where, oh my goodness, it's so bad, but a lot has changed. Even the prep has changed, hasn't it?
Yeah, we think the prep is much easier. People tell me that when they had theirs 10 years ago compared to now, it's much easier. Most people don't have a major issue with it, much like you thought it was pretty easy.
Yeah. Let's talk, what is colorectal cancer? Because a lot of people have different ideas of it, because some people think it's strictly just the rectal, but it's more to it, isn't there?
No, colorectal cancer can be throughout the entire colon. So the colon is responsible mainly for keeping, getting water out of your system and keeping you hydrated. And the colon goes from the right side all the way up to the top, and then down below into your rectum, where the stool collects before you're able to have bowel movement.
Yeah, I'm so glad we're talking about this, because as we said, people don't want to talk about, of course, their bottoms. They don't want to talk about that, and they're a little embarrassed to go see. I mean, I was a little embarrassed, because I thought, I thought I would be going to the bathroom everywhere and stuff like that.
Which you did not.
But I did not.
Nope.
I didn't.
Nope.
And that's the word we want to get out. Getting a colonoscopy is not like how it used to be.
No, I think it's a really easy process, especially anywhere, but especially here. We have valet parking. You can just go right up to the 4th floor and register, have your colonoscopy. We have an anesthesiologist who keeps you safe and comfortable, and you don't even remember it.
Yeah. And then afterwards, you sit and you talk with them.
Yes.
And you go over things with them. And I was awake. We were talking afterwards about it. And that's what's so important, isn't it?
Yeah, we like to give you your results right away. And then if there's anything further, we make an appointment and talk the next week. But we make sure that you understand why you're having the test, what the results are, and what you need to do in the future to help keep yourself and your family safe.
Yeah. And doctor, what's the message you want people to know about, of course, getting a colonoscopy and taking care of themselves?
We really want people who are approaching 45 or who are 45 and older, or have a family member who have colorectal cancer, or have any problems like blood in their stool. We want all those people to talk to their primary care doctor or to their gastroenterologist or surgeon about getting a colonoscopy or any kind of colon cancer screening. Yeah,
like I said, I got one done. I please recommend it to all those out there, especially in our African American and Latino communities. Don't be afraid. It's something that the doctor here can walk you through. Insurance is there for you. And that's the thing about preventing this type of cancer.
Absolutely.
So it's very important. Let people know where they can find out more information.
So at dignityhealth.org on our website, you can look for the Dignity Health Cancer Institute, and that has information about all of our programs, including our colonoscopy and our fast-track colonoscopy screening, where you just come for the day.
Perfect. Doctor, thank you very much.
Thank you.
Thank you, of course, for making sure I'm healthy.
10 years.
I like that.